Assalamualaikum and a very good evening to my fellow friends. Thank you for joining today's presentation. Hope all this knowledge can help you to understand better about the topic that I will present. All right. So first of all, my name is Noor Farhana, and today the topic that I will present is about glioma, or most specifically is about glioblastoma. So on this topic, all of you will get the information about the introduction, the etiology, the sign, and also the symptoms, type and grade of glioma, imaging modalities, and also the complication that you will have for the patient that have a glioma, and also what is the radiographic appearance for those who have a glioma, so that you can differentiate between the grade and also the type of the glioma, and the technical consideration, and lastly, the conclusion. So moving forward, the introduction of a glioma is a brain tumor within the central nerve system that originate from glial cells. It is a surround and protect brain and also spinal cord. The terms of a glioma is actually from the Greek word from glia, means glue, reflecting the supportive role that glial cells play in the nerve system. It is also classified by the type of glial cell involved of astrocyte, oligodendrocyte, and also ependymal cells. The etiology of the glioblastoma, it is a multifactorial involving the genetic mutation, the signaling pathway, and dysregulation, the epigenetic alteration, and also the environment risk factor. Glioblastoma also arise from a combination of genetic changes such as EGFR amplification, TP53 mutation, and PTEN loss, which drive uncontrolled cell proliferation, survival, invasion, and resistance to therapy. So those who have glioma or glioblastoma will have sign and also symptoms like headache, aphasia, seizures, the hemiparesis, nausea, and also cognitive impairment. So those who have a nausea, they will feel like something like feeling discomfort or sickness in the stomach, feeling an urge to vomit. Same goes to the headache, pain and discomfort in the head, face, and neck. Those who have a seizures, they will feel like the abnormal electrical activities in the brain. The sign and also symptom for the glioma, including the hemiparesis, which is the mild and partial weakness or loss of strength on one side of the body, like those patients who have a stroke, right? They're unable to lift up the one side. The same goes like this one. And also the aphasia is a language disorder that affect the ability to understand and communicate effectively. While for the cognitive impairment, the problem is with a person's ability to think, learn, and remember, or use judgment and make a decision. So, what is the grade and type of glioma? Basically, the grade is divided into 4 categories, which is the grade 1, low grade classification as a benign. It is a slow growing and well differentiated. For example, like pilocytic astrocytoma, which is common tumor in the children. While grade 2, it is a less aggressive, but it is still slow growing, but less well differentiated than grade 1. For example, like diffuse astrocytoma. While for grade 3, it is an anaplastic. In a categorized as a malignant, it is a moderate aggressive with anaplastic. The abnormal cell that derive more quickly. For example, that anaplastic oligodendroglioma. For those who have a grade 4, which is a glioblastoma, it is a very fast growing, highly malignant and with marked cellular abnormalities, necrosis, cell death, and the potential to spread widely. Glioblastoma, it is a multiform and the most common and aggressive form of glioma. So this is a type of a glioma, basically from the grade categorized. So for those who, for the astrocytoma, the tumors originating from astrocyte, a type of glial cell in the brain. And for oligodendrogliomas, it is a tumors that arise from oligodendrocyte, the cells that produce the myelin sheaths around nerve. For the ependymomas, it is a tumor arise from ependymal cell, which is a less common but can occur anywhere along the brain and also the spinal cord. So, although the glioma is most commonly occur in the brain, it is also can occur through the spinal cord, which is it can happen in the thoracic segment or the lumbar segment. For the mixed glioma, it is a contained element of both astrocyte and oligodendrocyte, like oligoastrocytomas. So this is an example of a grade 2 astrocytomas, which is in the image shown in the left area, which is on the marked area here. The astrocytoma present. While for the right images, this is a MRI images after the post-contrast. The presence of a glioblastoma, you can see here, which contain the central necrosis and irregulation enhancements after the contrast administration. This is the example of oligodendroglioma for the MRI T2 images, and also the coronal CT scan shown the oligodendroglioma present. It is typically minimal vasogenic edema with the contrast enhancement. And on the right side, images also the same, present of a gross tumor volume, as you can see here, yeah. This is the example that I said about the ependymomas. It is also can appear or occur in the spine of an adult patient. For example, like this one is occur on the end of spinal cord, yeah, vertebra. The right images here shown of ependymomas, like this one, okay, and the plastic ependymomas. So moving forward, this is the imaging modalities that can use to differentiate between the gliomas, the type, and also the grade, and so on. So the imaging modalities that can be used appropriate to diagnose and assess the glioma, which is contained of a MRI, a CT scan, and also the PET scan, positron emission tomography. So when we're talking about the MRI, it is a common modality for diagnosing brain tumor as it is the most sensitive for soft tissue. MRI also provide excellent contrast between the soft tissue compared to CT scan. The different MRI sequence, for example, like T1, T2, FLAIR, DWI, ADC, can provide insight into type of glioma. While for the CT scan, the CT brain plane will be performed, followed by the contrast agent to enhance the images. It is helped to assess acute intracranial findings such as edema, hemorrhage, and also brain tissue asymmetry. And advanced imaging consisting of neck and abdomen pelvis CT scan will be taken to investigate the initial source of the tumor. While for the PET scan, it is used to diagnosing any cancers, including glioma. The radioactive tracer will be injected through vein and the emission of the radioactive will be measured. Actin fluorodeoxyglucose is a glucose analog that commonly used to measure the metabolic rate. Metabolic activity will be measured to comparing the uptake value between the regions of the tumor and also reference region. So this is a few complications that patient with glioma will experience, right? It is a prognosis. It is a prognosis for patient diagnosed with glioma is vary according to age, comorbidities, grade, and location of the tumor. Low-grade glioma have a better prognosis with a longer survival rate, while high-grade glioma, like glioblastoma, has a poor prognosis given by its aggressive nature with documented survival rate of roughly about 5 years. So moving forward, possibility of recurrence is always there. There is always have another room for other complication after receiving the treatment, such as extensive neurological deficit. It will impact the patient quality of life. It also can increase intracranial pressure, the hydrocephalus, spinal metastasis, including death. So this is a radiographic appearance on what you will see if patient have a glioblastoma. So on the right images here, it is a shown of a pre-gadolinium image, shows instinct distortion of gray and white matter in the left cerebral hemisphere posteriorly. So on the left, on the right, as you can see, right images, the post-gadolinium image shows enhancement of this area. A central low signal in the enhanced area represents necrosis. A mass effect is indicated by shift to the midline structure. The septum pellucidum, a membrane which separates the lateral ventricle, is pushed to the right. This was an isolated lesion in the brain and was found to be a high-grade glioblastoma multiforme on biopsy. As you can see here on the left images here, the mass content of necrosis. The dark inside here represent the dark area, the dark side, and irregular shape present also one of the characteristic of a glioblastoma. For this one, a low-grade glioma or astrocytoma may show only a low-density area, whereas a high-grade glioma, which is a glioblastoma, usually show more contrast enhancement on the white outside and necrosis in the middle. This is what I mentioned before. So this is a low-grade. It is a low-density area, but for the high-grade, you can see the white enhancement and also the dark inside represent of a necrosis. Occasionally, a glioblastoma may appear as multiple separate tumor and look metastasis disease. Right? It is not only one spot. It can be multiple. So when it's multiple, we call it as a multicentric glioblastoma. This is one of the technical consideration, which is the best modalities that can be used to detect for the glioblastoma, which is MRI. The planning sequence and protocol are one of the most critical aspects of every MRI. It can help the consultant to differentiate between the tumor progression and pseudo progression based on the post-treatment radiographic changes. Diffusion with imaging, which is DWI, and also DTI. Diffusion tensor imaging are one of our MRI technique that use diffusion to provide information about brain and also surgical planning. With the combination of DWI and DTI, the appearance diffusion coefficient, which is what we call as a ADC, is created to help with differentiating benign and malignant tumor. The ADC imaging is also a marker for epidermal growth, factor receptor, which is what we call as EGFR. Amplification high is associated with increased angiogenesis. The DTI provide more detailed information about tumor as it can visualize a tissue architecture, particularly the white matter tract where the glioma usually migrates along to. In a way, it makes DTI more sensitive or delineating margin of involved parenchyma than the standard convention MRI. For the conclusion, the imaging is a fundamental pillar in the management of glioma patient, influencing every stage of their treatment journey, from first diagnosis to categorization, surveillance, and therapeutic monitoring. MRI offer a critical insight that inform a clinical decision. MRI also enable to precise a tumor delineation, helping to differentiate the glioma from other brain lesion, to monitor the tumor progression and also to assess treatment response. By offering a real-time details information, imaging not only improve survival outcome but also plays an important role in minimizing damage to healthy brain tissue, and also it can preserving quality of life and personal care. All right. Thank you for your time listening to the slide. So is there anything that you might not be understand or want further know about the glioblastoma?
Okay. So far so good. I can understand, but can I ask some question?
Yes, please.
Okay. What is sorry, stop. I don't. What is the risk factor then for developing the gliomas?
The risk factor for
The risk
developing
factor.
of gliomas.
Yes.
Okay.
I can
All
see
right.
this
Thank you for your question.
answer. Yes,
Thank you for
welcome.
your question. So the risk factor that for the developing of glioma, it is the while the source of the exact cause of a gliomas is unknown, but several risk factor that we can add to the glioma is by age, as
Oh,
gliomas are most common for adult. The gender also can be contribute to the risk, as men are slightly more than women to develop the gliomas. Then other genetic factors and also the family history also can contribute to the risk of a gliomas. I hope you
okay.
can answer the question.
Yes. Thank you. I can get it the answer.
All right. Any other question before we
Uh,
end the presentation?
I got some
uh,
questions.
Yes, please.
okay.
Can you hear me?
Yes, yes, I
Okay.
can. Please proceed.
What are the treatments option for gliomas?
Oh, for the treatment, for the treatment that involve of the gliomas, um, it is depends on the factor like a tumor type, the location of a tumor, and also the grade. Okay, one of the treatment that including is a surgery. Okay, once you diagnose with the glioma, so you proceed with the surgery. After proceed with all the process to detect. So surgery is one of the best is to remove tumor as much as possible without damaging the healthy brain tissue. Other than that, the radiation therapy after the surgery also is one of the options to destroy any remaining tumor cells, followed by the chemotherapy to stop the cancer cells from growing. Other than that, also involving with the targeting therapy, which is this drug target specific molecules involved in the tumor growth. All right.
Okay, thank you for the question.
Thank you. So I hope all the explanation and the information is okay. All right, so I end the presentation with thank you so much for your time. I hope we can meet again for other knowledge sharing in the future. Thank you and
Thank you.
Assalamualaikum.
Okay,
Thank you.
waalaikumsalam. Thank you, everyone.